Dr. Lindsey here. In this video, I'm going to talk to a repair hair transplant patient at 9 months. Now, typically, we do a hair transplant today. We clean you for a week or so. I like to see it about a month for a scar check, and then around 6 months to tell you that it's going to quit growing for a while, and then it starts back up. And then I like to see it about 13 months. And in a repair case, stretch that all out about 2 or 3 more months. But this fella came down from New York City to have his case done, and he was in the area at 9 months. So this is a 9-month result. I really never know what to expect at 9 months. Sometimes people look really good at 9 months, and sometimes people don't look so good at 9 months because there's always a kind of a stopping of growth. So watch this video. Hey, Dr. Lindsey here. I'm here with Steve, who came down from New York, and you're 48, right?
Correct.
And you're a big hoss of a dude, and last year you came in 9 months ago. Note that generally my videos are filmed at around 13 months, but Steve is in the area today, and we did him 9 months ago. And you'd had a hair transplant like in 2008, and the results weren't that great, right?
Yeah. Correct.
And so you look like this. Your pictures are up between us. And what I would describe your previous findings, you just had too little hair over too much big head. And it wasn't a terrible hair transplant because here you are shaved down, and there's definitely some grafts there. It just ain't tight enough. And we did exactly your case on a young man yesterday who, same thing, this is very common. People come in after an unsuccessful hair transplant, which actually was successful, just probably wasn't done quite right. And so we trimmed you down, and I made holes between and amongst the grafts that you'd already paid another person for. And in doing so, I'd do my best not to hit and kill any hairs that you have paid somebody else for, because they're working. And then we shave those hairs off, as shown here, and then we put grafts in. And you got 2,858 grafts, and this is what you look like at the end of the case. And then you came every day for a week, and you look nice and clean at the end. Sorry for the blurred picture. And then no sooner do you get back to New York and you call me on the phone, you hit your head on the light outside your house, and that drives me insane. And so here's a picture, but it didn't look like it really did much. And then I didn't see you until you walked in the door today. So I never really knew what people are gonna look like at 9 months. Occasionally somebody looks like I just threw their hair away and spent the money, and occasionally people look like they're fully grown. And I would say you're closer to the latter. And so before picture on one side, after on the other. And so I'm gonna comb your hair, sir. And so a couple things, it's still fully grown in, and your hair's reasonably short, but you look relatively unremarkable. If I saw you on the Amtrak or at the airplane place today, I wouldn't think there's a dude that's 9 months out from a hair transplant. You just look a normal dude. How much pain and suffering did I put you through?
Very minimal. The strip removal or the sutures for the strip there was some pain, as to be expected, but nothing abnormal. I was surprised to see or feel that at the 6-day mark, 7-day mark, the pain had drastically subsided. Minimal swelling, as to be expected in my case. And, the whole procedure itself went very well, much better than the last time that I had the procedure. And the results are fantastic. The scarring in the back, which is what most people are concerned about, the scar in the back, is next to nothing.
Here's a picture of it up close. And bend your head over a little bit, please. And so we're even a little farther. So probably this fall, we're gonna start right there. I expect this to look 25% better than it is now, and we'll go and we'll get 70% of that crown done, and then I think you're done. Any kind of bullshit or nonsense I pulled on you, sir?
No, you've been pretty straightforward. That's the one thing about any type of cosmetic or any type of situation where it's an elective procedure. There are no lies, there's no false truths, there's just honesty, openness, and the care is fantastic. Dr. Lindsey is very much involved in the patient from the start to the middle to the end, and that's very unique and very uncommon.
And my group's good, right? Wendy's good, Kamari good, yeah.
Yes, the group is fantastic, but again, as a patient, when you come to see a doctor for a procedure, when it's elective, you want the doctor to be involved as closely as they possibly can, and Dr. Lindsey is willing to do that. Always answers the phone. When I had the issue with the bump on the head, Dr. Lindsey took my call, reassured me that it wouldn't be too much of an issue, and that he followed the case throughout. So that's very comforting as a patient.
All right, man. Thank you so much for your business, and I'll look forward to working on you this fall.
Thank you so much.
So Steve's typical of our repair hair transplant patients. He's nervous it's not going to work because it didn't work that good the last time by somebody else. And particularly when they're from out of state, they think that, once we're done with them and the check is cash, we don't really care, which is not the case. I like to see people grow in, and I like to see the results at 13 or 14 months. And, show that with good quality hair transplant, generally, we can make people look unremarkable, meaning not look like they had a hair transplant, like some people you might see on TV and some politicians, but just look like regular dudes or girls, and that the hair or the hairline doesn't call attention to itself. We've done a little more than 4,800 of these. There's 560 some videos on our cases. If we can help you, give us a call. Thanks.